Good morning, afternoon, and evening for everyone who watched this video. I, Ren, want to talk about a thing that is popular among people right now, which is anxiety. And my title in this discussion is Perspective of Anxiety. What is that? Let's get into my discussion. Well, anxiety is a normal thing. It is an emotion everyone can feel. Where anxiety refers to feelings and thoughts that occur when the source of harm is uncertain. The subjective experience of anxiety is often marked by feelings of uncertainty, where in short, it's like when someone feels anxious or scared about things that haven't happened in their life, or when they feel scared about the future. Stress is the main thing anxiety reacts to. For example, before having an exam, before doing this discussion text video, before talking to teachers or making hard decisions, etc. Where anxiety is being debated because of course there are a lot of perspectives in it. But today, I only want to talk about two, which are friend and enemy. Where this perspective may affect qualities and comfortability in life, which means every decision made will have a very big impact in someone's life. The purpose of this discussion is to explore both the perspectives equally. Alright, let's get in the friend one, or the pro one. The friend side will think that anxiety is an emotion that can bring positive impact to them. There's something called PA, or positive affect, where it's a system that guides one's responses to potentially pleasurable or rewarding outcomes by experiencing PA itself, approach behaviors, and positive cognitions. For example, feeling happy, excitement, accomplishments, exploration, and any other positive stuff. This positive effect can be done with things like therapy, treatments, braveness, recognitions, like that. Where there's a thing called exposure-based therapy, where it's a treatment of choice which involves exposure to feared situation. It's like facing the fear or facing the anxious feelings. This positive effect plays an important role, which are learning, decision making, and motivational processes. There are some impact which are reducing the negative thinking, the overthinking, and bad stuff inside your head, inside the head, or inside the heart as well. Where in short, being positive in anxiety means using it as an emotion to help with life aspect development. Well, for short, it's like supporting your life. Next is the enemy side, or the con side, where of course they will disagree with the pro side, where anxiety doesn't really help them, but it can make it worse, or it will increase the anxiousness and make it worse. There's a thing called NA, where it is the back side or the bad side, or the other way around of PA, where NA is negative affect. It's a system, again, where it guides one's responses to potentially punishing outcomes by experiencing the NA itself, negative cognitions, and avoidance behavior. For example, isolation, pain, sadness, anger, and other negative feelings. But of course, this side cannot be coped the same as the friend side, because it has a different level, of course. It will be worse than the quality of life, where quality of life, or QOL, is a subjective evaluation of life in general and overall well-being, where of course there's a measurement with satisfaction with life and overall well-being. It will see or predict the long-term consequences and assess the effectiveness of treatment in anxiety. It's said that people with anxiety has poorer quality of life relative to those who doesn't have one. And sometimes they will abusively use substances such as drugs, alcohol, and other substances that is not good for health, because they might have low health, low social life, low emotional regulations, etc. And it will cause, of course, mental disorder, clinical disorder, even suicide and death. In conclusion, anxiety can be either positive, negative, or maybe both. Both of them have statements that are equally valid, where it can be a supportant and also a cause of disorders, where finding the most comfortable one and balancing both with personal life quality could be the most practical solution for this discussion. I'm Ren, and this is my discussion about anxiety. Thank you for listening. Goodbye.